Also, this session will be recorded and uploaded to YouTube, so anyone who couldn't attend can still get the information. If you have questions throughout the session, please type them in the Q&A box on the bottom of your screen. We'll answer questions at the end of the presentation, or someone will type back the answer throughout. If you are calling in your question, preparedness@phila.gov, or give us a call at 215-429-3016. Thanks to everyone from the health department here to answer questions. So let's get started. So the first little question I have for everyone to think about is, what are your favorite things to do in the summer? For me, it's spending time at the beach on the weekends, or going to have a picnic at Kelly Drive after work. The summertime is a season to enjoy the warmer weather, be outside longer. I see pool days coming in through the chat. Spend time outside longer since the sun is out later. But we have to be careful when we are spending a lot of time outside, because heat exposure can make you sick and can even be deadly. And so the first slide, or the next slide that I have up, excuse me, as the CDC studies weather hazards, they have found that extreme heat has been the cause of more deaths than any other weather hazard. On this slide, we have a chart from the National Oceanic and Atmospheric Administration. It shows heat at the highest number of fatalities when compared to other weather hazards like flooding, winter storms, lightning, tornadoes, and hurricanes. And for a lot of people, this can be surprising, because we often hear about the destruction from the other weather hazards like flooding and tornadoes. And so we'll talk a little bit about how heat affects your health a little bit later on. You may have noticed that summer seems to have gotten a lot warmer than maybe when you were younger. It is true that because of the climate emergency and climate change, the city is getting hotter. On this slide, we see a table that shows heat projections from Philadelphia's Office of Sustainability Growing Stronger report. The first row shows the average summer temperature in Philadelphia, and you'll see it shows 84.5 degrees Fahrenheit. And that's historically the summer average that we see. As we look to the future and over time, we know that climate change will cause the city to get hotter. And so our projections for the future is the average summer temperature to be 91 to 96 degrees. The next row shows the average number of days above 95. And historically, we don't see more than 3 days above that 95 degrees. As we look to the future and have projections, we are expected to see 28 to 67 days above 95 degrees, which is a lot, especially for Philadelphia. And then the last row is the average number of days above 100 degrees. And typically, we don't see days above that 100 degrees. But again, as we look to the future, we're expected to see 7 to 31 days above that 100-degree temperature. So we're expecting hot summer days long consecutive hot days. And so we want to be sure to help you all prepare for these high temperatures that can affect your health. And a little did you know, summer of 2021, Philadelphia recorded 37 days of 90 plus degrees. So we can tell that the city is getting hotter. Moving to our next slide, we will talk about the urban heat island effect. And so heat exposure is a big concern for those of us living in the city because of the urban heat island effect. This slide shows a slightly abstracted line graph that shows the overall temperature rising as you go from rural to suburban to commercial to city. This chart shows that while in the city we may be experiencing temperatures you can see in that like 90-degree weather, our suburban counterparts may only see temperatures in the 80s. Basically, this means that cities are hotter than their suburban areas because of built-in environment features like high buildings, industrial activities, lots of roadways that absorb heat. Cities in general and certain parts of each city can also have limited vegetation and tree coverage. And those types of plants, things, they provide a natural cooling by increasing shade and decreasing the temperature. And as we go to our next slide, we know that heat exposure also varies widely within our own city. And so the city developed a heat vulnerability index in 2018 to summarize the most important factors associated with adverse health impacts of extreme heat. And so this data-driven approach really identified which city neighborhoods are most at risk, so we can allocate some of the limited resources like cooling centers and buses and educational initiatives equitably. The index looks at demographics and socioeconomics, health status, and environmental exposures, and all that data is combined to form a heat vulnerability index map. And on our screen now, you can see a screenshot of our index map. And so this map shows an analysis of surface temperatures by census block. This map, as you can see, shows neighborhoods in Philly, and it indicates the hottest boxes or the hottest neighborhoods in red. That can be 22 degrees hotter than those cooler blocks that are in yellow. Some of these high heat vulnerability neighborhoods are Cobbs Creek, Overbrook, Point Breeze, Strawberry Mansion, Hartranft, and Hunting Park. Some of those neighborhoods that I mentioned have a lot of exposed asphalt, not a lot of trees or green spaces. And if you notice, some of the older homes have a black or dark roof, and that roof absorbs heat, making it hotter in that neighborhood. And I just want to highlight, you can visit the bit.ly/PHL heat index to search your neighborhood on the map. I'm going to slide it over quickly. This is what the map looks like, and you can type your address at the top here and see where your neighborhood lies on the heat vulnerability index. You can also find the closest cooling center, spray ground, pool, and senior centers. And so we hope you utilize this map to see where your neighborhood lies. This next slide is two pictures of neighborhoods in Philadelphia. The first picture at the top shows a very sunny day in North Philadelphia, with lots of cars on the street, not too many trees. In the next picture below, you see a neighborhood, also sunny, in Center City, that has lots of trees providing that natural cooling, shade, and then only cars on one side of the street. And so these two pictures just show how our city can differ depending on the presence of trees and cars, and knowing that there are multiple ways that the city can be hotter just by the absence or presence of trees. And so before we go to the next slide, I'm going to stop to make sure there are no questions in the chat. Doesn't look like it. So I'm going to pass it over to Shani, who's going to talk about understanding the signs and symptoms of heat-related illness.
So as temperature rises, it's important to recognize the signs and symptoms of heat-related illnesses. By understanding these symptoms, we can take proper steps to prevent and treat these conditions. So heat rash, also known as prickly heat, is a skin rash caused by trapped sweat under the skin. Symptoms are typically red clusters of small blisters that look like pimples on the skin, usually around like the neck, chest, groin, or in elbow creases. It occurs when you, if this occurs, you want to stay cool, sit in a dry space, keep the rash dry, and use powder to smooth the rash. Next is sunburn. So we all had experience with sunburn. If we haven't, we probably know people who've experienced sunburn. This occurs when your skin is exposed to too much sunlight. It causes the skin to become painful, red, and warm to the touch. Sunburn draws fluid to the skin's surface and away from the rest of the body, which can lead to severe dehydration if the sunburn is severe enough. If you experience sunburn, stay out of the sun. It's important until your sunburn heals.
Nó làm cho cái da trở nên rất là đau đớn, đỏ.
Sorry about that. If you experience, if you experience sunburn, stay out of the sun. It's important until your sunburn heals. Use cool cloths or sunburn on the sunburn area, or take a cool bath. So apply some moisturizing lotion to the sunburn area. Do not break any blisters, as this can cause further infection. So how can we prevent sunburn? We want to wear sunscreen with SPF 15 or higher. Apply it 30 minutes before going outside, and reapply as directed on packaging. You also want to wear sunglasses and a wide brim hat to protect yourself from the sunlight. Now, we've all experienced some type of muscle cramp in our lifetime, but in relation to the heat, it may be the first sign of heat-related illness. You may experience heavy sweating during intense exercise, muscle pains, or even spasms. If this occurs and you are doing physical activity, stop the activity, move to a cooler location, rest, and hydrate. It's important to seek medical attention if the cramps last more than an hour, or if you or someone has heart problems or on a low sodium diet. Muscle cramps could indicate something more severe, like heat stroke or heat exhaustion. Heat exhaustion happens when your body overheats and is having a hard time cooling itself down. It can develop after a few days of being in very hot temperatures or not even having enough fluids to drink. For example, you're sweating a lot and not taking in enough fluid. Symptoms include heavy sweating, cold, pale, and clammy skin, nausea or vomiting, muscle cramps, tightness or weakness, dizziness, headaches, fainting, sometimes passing out. If these symptoms occur to you or someone that you know, rest in a cool place, mostly air conditioned space. If you don't have AC, rest in a shaded area. Sip cool non-alcoholic beverages. Take a cool shower or bath. If you don't have access to these things, use a cool cloth or a wet paper towel. You can even use a t-shirt and place it behind your neck, under your armpit, or in the groin area to help cool the body down. If symptoms worsen or last longer than an hour, you should seek medical attention immediately. It could be something more detrimental, like heat stroke. So heat stroke is one of the most serious health heat-related illnesses. It occurs when the body becomes unable to control its temperature. The body temperature rises rapidly, the sweating mechanisms fail, and the body is unable to cool down naturally. It can cause death or permanent disability if emergency treatment is not received immediately. Some symptoms of heat stroke are high body temperatures. So this could be 103 Fahrenheit or higher, hot, red, dry, and damp skin, fast, strong pulse, headaches, dizziness, nausea, confusion, or loss of consciousness. If you think someone may be experiencing any of these symptoms, it's important to call 911 right away and then move that person to a cooler space. While waiting for 911, try and cool them down with cool cloths, pour water on them, cool them down by any means possible to get the body temperature down. As we approach the warmer weather, it's important to know what to do if someone seems sick from the heat. What we want to do is help them cool off. Get help and call 911 if you think it's an emergency. And it's okay if you don't know what type of heat illness they have, whether it's heat stroke or exhaustion. It's best to help them stay cool and call 911. Also try to get them help early before their condition worsens. Extreme heat events can increase risk of dehydration, heat exhaustion, and heat stroke for all people, but particularly for the older Philadelphians, children, and other sensitive populations, as you see listed on the slide above. We will use this slide to see who is at greatest risk of heat illnesses. So when looking at risk factors, we look at exposures, social factors, and biological factors. We want to especially highlight those without ACs, people who are homebound, people who are living alone, and older adults. These people never have a break from the heat. We want to make sure those warmer days in this summer, we are checking on our family and friends who may be most at risk. We want to prevent anyone from getting sick from the heat. So we'll be going over important tips to prevent heat-related illnesses. So drinking plenty of water throughout the day, such as drinking plenty of fluids out the day, such as water, sports drinks, or fruit juice, even if you don't feel thirsty. Plan your day so you don't spend too much time in the sun or heat. Avoid strenuous activities outside, between the hours of 11 a.m. and 4 p.m. when it's these are the hottest part of the day. Don't wait for an emergency. Don't wait for an emergency if you start to feel overheated. Go indoors or find a cool space immediately. You want to prepare your home for hot days with utility assistance, AC, fans, curtains, and supplies to stay cool. So later in our presentation, we'll talk about utility resources as well. And if you live alone, make sure someone knows to check on you. Or if you know someone who lives alone, make sure that you're checking on them as well during those hot days. So I'm going to stop here and see if we have any questions in the chat. Yeah. So next we'll talk about heat and chronic health conditions. Excessive heat can worsen pre-existing health conditions. These include diabetes, heart disease, kidney disease, respiratory disease, and mental health conditions. Some medications like beta blockers and diuretics, such as water pills, can also affect how your body responds to the heat. If you have any of these conditions or take any of these medications, it's important to talk to your doctor to learn how to reduce your risk of heat-related illnesses. So for those who spend a lot of time in their homes, we have some home heat safety tips to keep you safe and healthy. So once you use a fan, open a window and use a fan when it's cooler outside than it is indoors to bring cooler air in. If it's 90 degrees or hotter inside your house and it's also hot outside with little to no breeze, it's best not to use a fan because it will circulate the hot air, which can cause no relief from the heat. If you have a multi-level home, spend most of your time on the lower levels, which are typically cooler. You want to close windows and curtains along with your blinds during the hottest part of the day, which is typically 11 a.m. to 4 p.m. And we want to avoid using ovens or stoves during the hot weather, which can heat the home. We have several materials that we will share later in the presentation to help you remember these tips.
Thanks, Shawnee. So now that you've learned about heat in the city and recognizing the signs of heat-related illnesses, you might be asking yourself, what can you do next? First thing you can do is stay informed. And so pay attention to the local weather conditions and know when the weather might be harmful to your health. Multiple days of those high temperatures are the most dangerous. And you also want to know what to do if you see those signs of heat-related illnesses. Next thing you can do is stay cool. If you can, encourage your neighbors, your family members, your friends to avoid direct sunlight and limit your time outside. Shawnee mentioned that 11 to 4 p.m. is the hottest time of day. So if you can find time to go outside, not during that time, it's the best way to stay safe and healthy, especially on those warm days. And then the last thing, you can stay hydrated. Drink plenty of water and fruit juices throughout the day, and not just when you're feeling thirsty, so your body's temperature can stay regulated. Again, like Shawnee mentioned, you want to avoid drinking that alcohol, caffeine, and sugary drinks because those can increase dehydration. One of the most important things you can do, especially during a heat event, is make safe contact with those at-risk family members, friends, or neighbors that Shawnee mentioned. So make sure that they are using air conditioning if they have it, drinking plenty of water throughout the day, avoiding physical activity, wearing lightweight clothing, knowing those signs of heat-related illness, and know when and how to get help. Again, just to reiterate, checking in on your neighbors and family members who are most at risk of heat-related illness can help prevent negative outcomes when temperatures are hot. Okay, and so this next slide is about our heat response actions. The city has a warning system that lets people know when they should be concerned for their health during extreme heat events. And so the first is a heat caution. A heat caution activates public messaging and puts partners on standby who will offer services to people in the city. During this, oftentimes a code red is happening and the city performs 24-hour outreach to people who are unsheltered. People on our community response partner network get messaging, so we hope that you are all signed up for that. The next alert system is our heat health emergency. And this is declared when temperatures are of concern for our health. And so the city will activate Philadelphia Corporation of Aging Heat Line and PDPH mobile teams. The activation of cooling centers with extended hours, and then halt utility shutoffs for residents in non-payment status. And so to be the first to know about when a heat health emergency and other public health hazards are happening, we recommend signing up with OEM to receive up-to-date alerts and text Ready Phila to 888-777 or visit phila.gov/ready. I mentioned that during a heat health emergency, the PCA helpline is activated. That number is 215-765-9040. During a heat health emergency, PCA operates a call center for people to get heat safety tips. Health department nurses can speak with people about medical problems related to heat. One thing we do want to mention is that the heat line does not give out free air conditioners or fans. And so our next section, we're going to go over some of the resources. I think this is what everyone has been waiting for. And so we will first start with our cooling centers. Cooling centers are air-conditioned spaces that stay open late during a heat health emergency. Oftentimes, those are your local library, your rec center, some of the older adult centers. And so you can call 311 to find a cooling center near you. If you can't get to a cooling center, we recommend, again, visiting your local senior center, a shopping mall, go to a friend's house who has air conditioning. Even a short time in air conditioning can help your body recover from heat. Next, we have our public pools. They are a great way to cool off with the family. Last year, 50 pools were open for the summer. The city pools also offer free swimming lessons. And so for more information about city pools and for the pool opening schedule, you can visit phila.gov/PPR. And then the last fun way to stay cool are our spray grounds. You can see a picture of some little girls playing in the spray grounds. They're often all around the city. and they're not just fun for the kids. And so to find a spray ground near you, you can visit bit.ly/spray ground finder. This next resource we have is called ArtReach. The city has a number of museum and historical sites that are a great way to spend indoors during really hot weather. And so ArtReach is a great resource to share with your family and friends. You can visit art-reach.org for locations. They provide $2 admissions with access and EBT cards and free admissions for kids under 18. We recommend you to encourage your neighbors to explore some of these museums and sites on very hot days. And so we've been mentioning the importance of using air conditioning, but we realize that that can increase bills. One of the biggest ways you can prepare for the summer weather is by knowing what to do with utility assistance programs. And so one program we like to highlight is USEF. They provide up to $1,500 to help pay for your energy bills. You can contact USEF at 215-814-6837 or email them at utility@usefacts.org. We also have, we'll share the materials and the resources from this presentation with you all at the end, but we have ways to get more information about these programs. This is just a picture of the flyer that can be sent to you all. This slide is some of the programs that can help pay utility bills. So we encourage you all to look into these programs. We have PHL neighborhood energy centers where you can apply for bill payment assistance and learn how to conserve water, gas, and electricity. Basic systems repair, you get free repairs for electrical, plumbing, heating. I talked about USEF Acts, and then the last one is PICO_help, and get a monthly credit towards your PICO bill and look into any other supports. For everyone in this training, you are getting to know about some resources early, so in case of emergency, you're already prepared for the summer heat that we are expecting this summer. This next slide is about preventing water shutoffs. And so the Water Revenue Bureau and the Philadelphia Water Department offer a number of bill payment agreements for qualifying customers. So we really recommend to visit the website bit.ly/prevent-water-shutoff to learn more about these assistance programs. The first one I'll mention is Apply for Assistance, which is a 30-day window of protection from water shutoff to any customer who requests an application. The next one is Request a Payment Plan, and you can give a call to the Water Department at 215-685-6300. Next one is Medical Delay. If you are sick and need water service for health reasons, the Water Revenue Bureau may delay the shutoff for your services for 30 days. And then lastly, we have Raise Your Hand, which is a shutoff exemption for seniors who are 65 years and older, a person with a disability or serious illness, and children under the age of 18 living under the roof. Your water will not be shut off. And so we really recommend that you all take advantage of these programs and learn more about them and how they may be able to assist you this summer. All right, and this was just a slide on the neighborhood energy centers that I had mentioned earlier. There are a number of different centers within Philadelphia where you can learn about conserving your energy. So feel free to scan the QR code or visit the bit.ly/PHLNECS to find a neighborhood energy center near you. So 2 years ago, we developed the Extreme Heat Guide in partnership with the Office of Sustainability. And anyone can go to www.phila.gov/heat to read about extreme heat events at any time of the year. This site has information on who's at higher risk of heat-related illness, heat safety tips, um, a number of different resources and downloadable and printable resources in multiple languages. And so you can, again, visit that www.phila.gov/heat. Whenever there is updates to the phila.gov blogs about heat emergencies, that will be updated on this page. And we're getting to the end. Just wanted to share that all of the information that you learned in this presentation is available in printables and downloadables, so you can share with your family and friends or just have on hand for yourself or for your organization. All of these materials that we have been translated in multiple languages and are free to order and can be mailed directly to share with you and your family. And that concludes the end of our presentation. You can feel free to stay connected with us at Public Health Preparedness at phila.gov. Leave us a message if you have any questions at 215-429-3016. Again, we hope you are all signed up for our Community Response Partner Network. That if you aren't, you can sign up at bit.ly/PHL Community Response to stay up to date with health alerts from our program. I will stop to see if there's any questions in the chat. I think they are all being answered. Yes, well, if you have any questions, feel free to contact us. If you would like educational resources for your family and friends or for your organization, please connect with us again at Public Health Preparedness at phila.gov or request free resources to be mailed to you at bit.ly/PHP materials. Thank you and stay cool this summer.